Can you tell us your personal experience coming to Canada as a foreign-trained nurse?
Absolutely. I was trained in England, UK, and when I first arrived, it was a lot of hoops that I have to jump through, so to speak, and certainly. It was very tough and challenging at that time, as English is not an issue for me because I was trained in England, and coming over to Canada to get the credentials, to make up the courses, to pass the exams, and do it all over again. It seems to be a very challenging situation for an active registered nurse.
And you know, Queenie, hearing your story, it's very similar to many of the other stories that I've heard where, you know, they have years of experience from a different country, years of education. It's not a problem transferring that over, but the amount of resources and time and money that it requires is what could be really challenging. What are you hearing from people who are coming to Canada, nurses and other professionals who are trying to work here?
Well, exactly. You know, while I understand that the professional organizations really wanted to protect the safety of the public and serve, the healthcare, deliver healthcare to the public. However, I think that it is very important to look at the process. How do we need to streamline it so that, really those individuals who are qualified to take on those professions will be able to get the credential recognized in a very expedient way.
And Queenie, there's a heated debate happening right now in this province about the possible privatization of healthcare services after Ontario's health minister said that all options are on the table. How do you think privatization could help or hinder those trying to become accredited in Canada?
Well, I'm not sure how it is going to impact, but certainly I think that whatever way that it will take shape, it needs to serve the public well. And it is important to be equitable healthcare to everyone, Canadians. So whatever that takes shape will be, it needs to think about the principle of healthcare for all, and also being equitable for all, and protecting the public safety and health to each individual and each Canadian.
And Queenie, let's talk a little bit about streamlining this process of credentials, starting with, how much time and cost does it take for a foreign trained nurse to be accredited here in Canada? And then what kind of solutions do you think you could offer to help streamline that process?
Absolutely. I really think that the process needs to be streamlined. Right now, it could be up to 12 to 24 months for an individual to get their credential recognized. So I think that, first of all, for those people who are in their own country of origin, perhaps we can utilize the pre-arrival services that our immigration department actually offers, so that they actually could understand how much is required, and the assessment needs to be done, even prior to coming to Canada, so that when they arrive, they actually be ready to go in terms of looking at the gaps and, the clinical practice or sitting for the exam. So they would be all ready to go rather than going through the whole process, on arrival. And secondly, I think that it's important that, the individuals would be able to access and be aware what needs to be done, because there's so much information going on, and be aware of any of the fraudulent scam out there, and be able to help them to look at whether they needed to pay for the exam or they can access some grant or bursary in order to get their credential recognized. And we do have the foreign credential recognition loan program for those people who require a loan. So I think that a case management approach to help those individuals will be greatly appreciated, so that they will be navigated in the right place at the right time. And essentially, it's to get their credential recognized.
And Queenie, quick final question, because we've been hearing this from healthcare workers. You have so many years of experience in this line of work. Do you feel heard?
I think that certainly the messages has been there, and I think that it needs to be done, and we need to take action to ensure this is expedited. Otherwise, we're losing the talents, we're losing those individuals who we so much require in our healthcare system.